There we go. There we go. Thank you for joining us and welcome. My name is Shireen. I use she, her pronouns, and I am a project officer with the Canadian Public Health Association. And I'm joined here by my colleague. If you want to introduce yourself.
Sure, I'd be happy to. Hello, everybody. My name is Becky Van Tassel. I use she, her pronouns, and I am the manager of youth programs at the Center for Sexuality.
There we go. So before we begin, the Canadian Public Health Association is located on the original unceded territory of the Algonquin Anishinaabe people. As they've been the guardians of this land for millennia, CPHA is really grateful for the example that their stewardship provides. And we say this in recognition that this is only a very small part of work towards meaningful reconciliation. So I'll just introduce the Canadian Public Health Association very quickly. So we are not part of the government, despite what everyone thinks. We are different from the Public Health Agency of Canada, just to get that out of the way. So our vision is a healthy and just world, which is a very lofty goal. So we are trying to enhance the health of people in Canada to contribute to a healthier and more equitable world. One thing I'd like to say to explain what public health do is doctor is to individual as public health is to the population. That's clear as mud. But we're a national not-for-profit, and we all believe in universal and equitable access to the basic conditions which are necessary to achieve health for all.
And I'd like to also start by saying that Center for Sexuality is located in Treaty 7 in Mohkinstsis, otherwise known colonially as Calgary. I would like to acknowledge that the Treaty 7 nations who are making their home on this land, including the Siksika, the Piikani, the Kainai, the Tsuut'ina, and the Aiyahe Nakota First Nations, including the Chiniki, Bears Paw, and Wesley First Nation. This land is also home to the Métis Nation of Alberta. Center for Sexuality is very grateful to the humans who have stewarded this land and have protected this land for us to all enjoy such abundance. But as an agency, we also are very cognizant of our own role in reconciliation. Part of this work, teaching about healthy relationships with young people, I think is a step towards reconciliation. As we talk about consent, we reflect on colonial values and how those have impacted the ability for folks to consent. We talk about treaties and how there was not treaty consent present when treaties were being signed. And so for today, I encourage you all to think about the land that you're currently situated on and the individual actions that you take as well towards reconciliation. So the Center for Sexuality, we also have fairly lofty mission, maybe not quite as lofty as CPHA's, but we are a national organization. We've existed for 50 years. We are a health promotion, primary prevention organization with a mission that is focused on teaching, training, and advocating to support healthy bodies, healthy relationships, and healthy communities. And yes, here is our very lofty vision, sexual well-being for all across the lifespan. So Center for Sexuality has been providing our relationship and comprehensive sexual health education for 40 years. And we're very excited to be part of this project as we scale out our curriculum to other places and learn from you folks and help ensure that youth are getting really quality, comprehensive sexual health education across the country. Shireen, you're muted, as is.
There we go. Sorry, my screen looks very different because I'm in presenter mode. I'm not usually the one sharing slides. Okay, so our agenda for today is we're going to try and take as little as your time as possible. So we will be ending right at 1 o'clock Eastern. So we'd like to do some welcome and introductions. We'll give you an overview of the project for which we are looking for collaborators. We'll give you an overview of the relationship and sexuality education program, which is what the Center for Sexuality specializes in. We will go over some logistics of applying to be part of this project. And then we've got a bunch of frequently asked questions, and we'll open the floor to all you folks. If you have questions as we're going along, please feel free to put them in the question box, and we will let you know whether it's something we're going to address in a couple of slides or something we can answer a bit later. So we've introduced ourselves. Okay, so as part of the initiative for preventing, as part of FACT, the Public Health Agency of Canada's initiative to try and prevent youth dating violence, we submitted a application back in 2018, I believe, to try and use this program that the Center for Sexuality has, the Relationship and Sexual Health Education Program, as an actual intervention to try and prevent youth dating violence. Now, Center for Sexuality has done this very well for a very long time, but they've also had amazing training and facilitators more senior facilitators available to help them out. And we decided to see, can we actually scale this program out to other places in the country? We've got someone else. Okay. So besides the reduction in youth dating violence, Becky can speak a little bit more about what we're hoping to achieve.
Yeah, so our program ultimately seeks to address and enhance capacity, opportunity, and motivation for young people to be able to access their sexual health rights, their services, have increased autonomy. And so really it is looking at things quite broadly. For us, comprehensive sexuality education includes relationship education, 2S LGBTQ inclusion, talking about sexual violence. It really is about looking at all these different factors which can enhance and increase our sexual well-being. Our agency also uses something called COMB, which builds on Kirby's IMB model, where we are really intentionally enhancing capacity, providing opportunity, increasing motivation in order to have behavior change occur with young people as it comes to their sexual health. So the next slide, Shireen. So we are also looking at, like I mentioned a little bit already, but 3 core and interconnected domains in this. So sexual and reproductive health promotion, healthy and respectful education, and violence prevention and consent skills promotion. So it really is, it's a scaffolded curriculum. We have 4 different programs, which kind of are 16 sessions that build on each other one after another. They're designed to be offered in each grade, as is developmentally appropriate to young people. Next slide.
I think I might have missed one slide. Oh no, we're good. Okay.
Maybe you could toggle through this. There we go. So as I mentioned, our curriculum is, it's designed on best practices in sexual health education. It also is designed on sort of best practices around young folks, where they're at developmentally. We have pilot tested this content quite a bit. We also have a lot of very strong and robust evaluations, which can prove that we are seeing behavior change in several domains. We also are able to take this curriculum and match it to different provincial guidelines across the country to ensure that we're still hitting the curricular outcomes that would be laid out by each of your provinces. So in grade 7, we really start to look at puberty, healthy relationships, decision-making, menstruation. A lot of work at this stage is done on media literacy and how to work with natural support. So parents, guardians, how do you have those conversations with the folks in your life? We further build on this in grade 8 to talk about sexuality quite broadly. we start to think about our own personal values and critically think about the values that society upholds around certain topics. We start to really talk about different definitions and ways of thinking about gender, sexual orientation, and sex assigned at birth. Again, we build on decision-making and start to think about decision-making as it relates to sexting and some of the things that are currently very, I think, prevalent and real for young people today. Again, we continue to look at media literacy and social media considerations, thinking about what do we share online, how do we create safer and more welcoming communities in an online environment above and beyond just our physical environments, of course, healthy relationships and natural supports. Grade 9, it's interesting because, we really start to talk about birth controls and STIs then, which conventionally we had talked about that sooner, but some of the things that we started to realize is that without giving folks the healthy relationship skills, without teaching them about how to advocate for their needs, to use assertive communication, it's much more difficult to teach people about birth control and STIs and say you have the right to this, but not provide communication skills and ways in which they can actually talk to their partners about the things that they want or the things that they need. So we of course do have resources around STIs and birth control that we provide in program 2 and 3, or 1 and 2, which is grade 7 and 8. But in grade 9, it's where we really start to get into those pieces. So again, clarifying our personal values, our values around sexuality, respecting our own boundaries and boundaries of others. So how do we deal with rejection? It's a big part of the conversation at this age. Different types of sex, rather than getting into the nitty gritty and the biology of birth control and STIs, we do a little bit, but we also are really focused on destigmatizing STIs, helping folks know where they can get tested, helping folks also understand what their sexual health rights are when it comes to birth control. How do you access that? What are the things that you can do? Can you get birth control without parent and guardian consent, for example? We also, of course, continue to talk about healthy relationships in a way that's more developmentally mature for this program, natural supports, and consent. Now, this says CALM. For us, that would be offered in grade 10, 11, or 12, or if you have a very advanced group, you could offer this program. This is a longer program. It's about 7 hours. And it is sort of the capstone, if you will, of all of the other education. So we talk about values, consent, sexuality. We really start to deconstruct harmful norms around gender and sexual scripts. How does that show up? How are they seeing that in the media? How does that show up and impact their relationships? Human rights, again, healthy relationships, but more very specific, I think, to the types of relationships folks will likely be having in this age range. Violence prevention, understanding coercion and control. Who do you talk to if you require assistance or help? How to be an engaged bystander. Again, how do you access accurate sexual health resources? And how do you challenge sexism, racism, homo, trans, biphobia, classism, and ableism? So those are the kind of the overview of them. What I will say too is that we do call them typically program 1, 2, 3, and 4, and we have a needs assessment that you can use with schools or community groups if that's where you're implementing, which will allow you to say, yes, probably based on what these youth know or their environment, their cultural context, program 4 would make the most sense. So we are also able to help people kind of determine which program would make sense and where. All right, Shireen, I'll pass it on to you.
Okay, so there are several principles that have been drawn upon to talk about effective prevention programming. So you can see them here on the screen. And when we say comprehensive, we mean that we want to target folks at different levels of the social ecological model. This basically says, you're right in the middle of your interpersonal relationships, which is inside your local sort of community relationships, which all comes down to what the systems in your life say or do. So for example, we want to make sure that someone knows that they have the right to consent, for example, but we want to make sure that there are also rules or guidelines in place to be able to help them out if they need help around this, so that they know it's not all on them. Using varied teaching methods is really important because the message is best absorbed when it's delivered through different forms of media or presentation. So you'll see some of the lessons are done through brainstorm, some of them are done through games, some of them are done by slightly more didactic teaching. And it's just to make sure that everyone gets their learning needs met. Sufficient dosage. So basically when we talk about an intervention's dosage, we're talking about how much do they actually receive from the program. And so this is why we don't do one-off teachings. It's not a go into a school for one day, teach them all at once, and then come back again a year later. It's about the intervention being delivered over a period of time with multiple exposures, and that's going to help increase the knowledge and develop the skills for putting the knowledge into practice. Theory-driven, Becky already spoke about this with the social emotional learning and the COM-B model. So this isn't just a matter of, we thought about it, we wrote some things down, here's a curriculum, but rather there is great research that has gone on by people much smarter than me, and we're using their guidance there. So emphasize positive relationships. This one's pretty simple. The programming should facilitate positive relationships, and building and modeling those relationships work best. So nothing too exciting here, but this is why we often talk about using a co-facilitation model. Appropriately timed, as you can see, there are different stages for different grade and age groups. And we just want to make sure that the program is developmentally appropriate and that it begins as soon as possible as the students need. Socioculturally relevant, so it should be creation by and for specific community and incorporate the cultural norms and reflect the social context of the community. We'll talk about that a little bit more with the with some of the questions later on. There should be an evaluation. How do we know if what we're doing works if we don't evaluate it? So that is, we have goals, objectives, implementation, outcome measurements, and we make sure that we're actually meeting the goals. Delivered by well-trained staff. We do three 2-hour trainings in the time leading up to our 3-day training, which will be happening online in October of this year, to ensure that the facilitators are going in properly armed and with a lot of good information. And finally, it needs to be evidence informed. So the content, the structure, and the delivery of the program should be evidence informed and use the best and promising practice. So again, we're not writing down some ideas and saying, this is what you need to do, but rather there's evidence and there's information about why this works.
Okay, so we also can offer the program within community settings. What this might look like is, working at a drop-in space for youth. That can be tricky because, of course, they may not come to every session, but that is something that folks are welcome to do. Our content has been pilot tested quite a bit at youth detention centers, within mental health and addiction centers, within residential focused programming where youth are. This is another place that could be, an easily implemented kind of area for the programming to occur. Again, like I mentioned, we will have a needs assessment that you can deliver with the community partners. We then meet with you to say, based on their questions, it looks like they're looking for program 3. The one thing is that for all of our content, it does have to be it says 4 to 5, but really it's 4 to 7, depending on the program chosen, hours of instruction. This can be spread over 2 days. It can be spread over 4 days. Particularly in community, we can be a little bit more nimble about what that looks like. But we do need to have full amounts of time to get through all of the content. Okay, so for next year, which feels like 5 seconds away at this point, we do have a few different delivery options for 2022 and 2023. So in-person facilitation, of course, this will depend on your school boards, what things are happening within your school boards. Are they allowing outside, speakers to come in? Really, it kind of depends on what COVID looks like and what your COVID protocols look like in your jurisdiction. You can also offer the program online, where schools are actually participating from their classroom. Facilitator is remote. And lastly, you can do remote with the students joining virtually from their own kind of personal computers. What I will say about Center for Sexuality, our move for next year is to go back fully in person, just because we're finding it's just students are not as engaged at this point of the pandemic with online learning, and within our school boards anyway, they're allowing guest speakers back in. So we've put in some COVID protocols in place for our facilitators. So we will be back in person. Of course, though, there is no hard rule around this from a research perspective or from an implementation perspective for sites. Basically, you do what works best for your community.
Okay, so this program probably sounds absolutely amazing at this point, or maybe like something you're not interested in. I think you'll have a bit of an idea by this stage. Yeah, okay. So what we're looking for is organizations who are interested in facilitating this kind of program within their schools or communities. And we're looking for these organizations to become our collaborators. Being a collaborator would mean that you put in an application, we interview you, we think you're awesome, and then we bring you in for some training before we let you out into the world and with the curriculum and see what good you can do. Not to say we don't have a lot of support afterwards. We're always available for questions, concerns, tricky questions that come up and you're not sure how to answer, but we will do extensive training prior to you starting the programming in schools or community settings. So I'm not going to be able to put this in the chat because my screen is looking funny, but I will put this in the chat at the end. There is an application you can download. It's a locked document, which means it gives you lots of background, and then you're only able to put in text where we're looking for responses. This just helps us keep the size of the file down because we cannot accept attachments larger than 10 megabytes, which, whatever you think of that, it's we can't accept, like our server cannot accept it. We're looking for these the application to be submitted with three other things actually. The appendix, which is also available on the website, which is basically just a template letter letting us know that you've engaged a school or a community organization to be able, and they're interested to have you come in and facilitate. It doesn't have to be written in stone. You don't have to have dates yet or times yet. You just need to have that, yeah, there's a feeling we want to do this where we are. Then we're going to ask you to send in the CV of the facilitator that you have, or the person who will be facilitating this program. And we're not being picky or really judging you here. We just want to make sure that there is some kind of background for the work you're doing, and you're not going to be completely thrown off guard by working with youth. And then finally, we're asking you to upload a YouTube video of yourself speaking 3 or 4 minutes, or of the facilitator speaking for 3 or 4 minutes, just to give us an idea of how you speak, how you speak, especially when you get excited, because I think this is a program that people can get really excited about. Doesn't matter what the topic is, we just want to hear you speak and see how things flow. So you'll send these files to youthrsc at cpha.ca or to myself at snoble@cpha.ca. I will make sure all of these are in the chat at some point. And we are going to be accepting applications until July 20th, 2022, but we'd really encourage you to get them in earlier than that because we are actually reviewing and accepting applications on a rolling basis. So if other organizations kind of get theirs in first and we find enough facilitator or enough programs to collaborate with, we may not see yours that comes in at the very last minute before we choose. So we currently have a number of collaborating organizations. I hope you can see my mouse moving around now. I deal with more of the logistics part of it, so you'll probably be dealing with me quite a bit in the beginning if you're accepted. So we're located in Ottawa, and Center for Sexuality is located out in Calgary. And this is fine because we do basically all the training online. We've had a number of different groups from several different provinces apply and actually collaborate with us over the years. We have someone out in Nova Scotia, Montreal, Halton, Chatham, Kent, way up in Temiskaming, then in a small community in Manitoba, then at Planned Parenthood in Regina. And we have a group that's actually out in the Yukon delivering this program for the first time this year. So we definitely love to get a variety of applications. So if you know folks even in other provinces or territories that might be interested in this, it would be great if you could pass the information along to them. Okay. Then let's say everything goes well, you get to be one of the dots on you're chosen to be one of the dots on our map. Then we'll start with training. Now the training is mandatory. If there's one date you're not available for, we might be able to do something like record the session for you, but we really do need you to attend the full 3-day session. Now, the 3-day session sounds like a lot, but I promise it's 5 hours a day. It's not the entire day, and we do give frequent breaks in there. Online, it can seem daunting, but I promise we'll make it work. We'll try and make it as interactive as possible. So all these times are in Eastern time. We don't know exactly when things will be facilitated though, because we don't know where folks will be located. So if everyone's located in a later time zone, we can start a little later, Then after you're done the training, we'll ask you to start engaging with the school or community partners. And this is just to let you know, we're not sending you in blank. We are sending you in with lots of information. You can see the table of contents of this great document that we'll send you to make sure that you have the information to talk to your schools, the schools or community organizations that you're working with, so that it's clear what you're asking for, what you're doing. Just make sure everyone's on the same page, and we are here to support. I am here to support you throughout that process. So let's say that all goes well and your school or community center are going to be participating. Next, what we'd want, these are sort of the ongoing expectations we have of programs. First, we need to know that you're communicating regularly and managing expectations with your schools. It's been a really weird couple of years for schools, and we want to make sure that they're still on the same page. Make sure you're checking in if rules have changed. Maybe they had said online at one point, but numbers are way down and you want to do, and they are able to take you in person, you may prefer to do that. Then we want to make sure that our collaborators are nurturing a positive relationship with the entire team. you're going out with the Center for Sexuality curriculum. The CPHA name is attached to it as well. And we just want to make sure that, people are being quite responsible with how they present this program and these organizations. And then we are just going to ask you to keep things up to date. So we have some forms that'll be filled out throughout. And after every lesson that you complete, we'll ask you to fill out a delivery log. And that's just a bunch of very easy questions, checking off a lot of check boxes to let us know, what part of the curriculum worked really well, what didn't, did you make any adaptations? Was there anything weird that happened in class that may have changed how the lesson was facilitated, like a fire alarm? So those are our expectations of the organizations. Now, we're also doing some research and evaluation related to see if this program is an effective intervention to prevent youth dating violence. So there are some different aspects for which we'll be evaluating the facilitators as well. Now, that doesn't mean we're going in and observing you and saying, no, you did this wrong or you forgot this word. No, it's to evaluate your experience with this program to see if you felt supported, if there are questions you had that were never answered, things like that. So there's a couple of different surveys we'll ask you to fill out at different times, all online, all fairly quick. And then at the end of the school year, we'll ask you to take part in an interview with someone outside of our organizations, just to make sure, we're doing things properly. Now, we also have to figure out if this program is working for youth. So that means that when you go into schools or community settings, we're going to ask you to do 2 surveys with them. Once on at the beginning of the first day, so that we know sort of where the youth is at a baseline level. And then again at post-delivery. So ideally this program would only be delivered over 5 days in a row, which means that there's not a huge amount of time to see a change in a student's behaviors, attitudes, beliefs, things like that. That's why we also ask in the post-delivery if we can contact the students again. And we want to contact those students in 6 months' time to see, were there any changes that happened when the program was delivered, but also how are those changes doing after 6 months? Have they gotten better? Have they gotten worse? What's going on? And we also need to work, in order to do these surveys, we will also need to work with you to find out whether your school board or community organization has their own research ethics board and whether we need to apply to that. So that's something we'll work with you on from very early on. Okay, so what are the benefits to you? We do give you a stipend for any of the expenses you may incur from this. You can use that as you like. It's probably not enough to bring a full-time facilitator on, or it's definitely not enough to bring someone full-time on, but we will be able to contribute something to the staff time and resources. You're going to receive great training on how to facilitate to students and youth, sexual health, relationship health, and a lot about inclusivity and making sure that we're using inclusive language and actions as well. We will give you access to this evidence-based curriculum that's been developed by Center for Sexuality over the course of 40 years. And then I'll be around for the logistic support that you will have to help answer your questions or support with anything on an ongoing basis. I'm just going to pause there and ask if anyone has any questions at this point. Write in the chat, or you can you can raise your hand with the function in Zoom. But I'm going to move on now. So I want to talk a little bit about the expectations and some of the frequently asked questions that we get. So the biggest one is that we want to make sure we're clear about is, do you need to have a facilitator who is hired right now to facilitate this program? And that's a little complicated, but yes, essentially we are asking you to have a facilitator currently, someone on staff who can be trained. They don't have to have the background in sexual and reproductive health right now. If they're used, if they do a lot of youth work or things like that. The reason we're coming down a little harder on this than we did in previous years is because there's not a lot of time left after we review we accept the different groups and the training, and we want to make sure that every group that is going to be collaborating with us has a facilitator there at the training. So basically, if you have a facilitator you're in the process of hiring an education coordinator or facilitator who is fantastic, and you're making offers right away, then yeah, we definitely consider bringing someone in who is new to the role. But we don't think, with the summer, we know that hiring can take a long time, and we want to make sure that they're going to be ready to go for September training. So people often want to know, can I add things to the curriculum? So this, sometimes people have seen great videos on YouTube or different resources that they've collected over the years. And basically, there are places where you can put things into the curriculum, but those are things like local statistics or facts, cultural adaptations, or other relevant material. So that's not to say that you can't add anything. It's just a conversation that we'll ask you to have with us prior to putting it in, to ensure that it's not changing the core components of these lessons as they've been designed by the Center for Sexuality. And we do encourage you to put in this local information to make it contextual for the students or youth you may be working with. Then can you share the curriculum? You get the program, you think, oh, this is so amazing. I want, this other organization that I volunteer with to have the curriculum. And I do want to make it clear that the curriculum is not to be shared. It's proprietary information, but it's something you can keep after this evaluation has finished next year, and potentially continue offering to folks in your area. So even though we're not around, the sex education, relationship education can still happen. We also want to make sure that it's clear that only the people who are trained in this in this program are able to do the facilitation. So if you hire someone, they go through the training, then get their dream job somewhere else, it's not as simple as just pulling someone else from your organization and say, read these notes and go facilitate. It's more, it needs to be someone who's trained. So just to keep that in mind, if you have staff you think may not be sticking around for a long time, you may want to reconsider who you send to the training for the online training for facilitation. Okay, then there's a whole, I'm camera shy. Why do I need a video to be posted on YouTube for us to watch? Basically, we want to know how comfortable you are. Some people are not great with being up in front of a crowd or unable to speak on the spot or in front of a camera. Which is just something we want to know in advance, because, if you're not comfortable facilitating, that's fine, but it's not necessarily someone who we're going to bring on to be a facilitator. That's not fair to anyone involved in the situation. So we're not there, like I said, any topic you want, but we're not there to evaluate the content of what you're talking about. We want to see about your comfort and how you present, and, are you engaging? Things like that. Okay, now this is a big one as well. People often want to know, Well, this is designed in Calgary. It's based on the Calgary, matching with the Calgary education standards. What does that mean for my province? Well, we have good news. We will provide you with a lot of information that directly maps on where the RSE curriculum matches particular curricular goals within your schools and within the province. So we will send you with a lot of information to answer these questions. And yes, often these can be used in conjunction with, possibly even instead of, your province or territory's curriculum, if you're going to be delivering, particular topics. So we'll give you that information, and we're also going to provide you with additional resources and documents, such as the one I showed you before, that will help you to present the curriculum to the school. We're not just going to say, go tell them about it, but there's a lot of information that we want you to be prepared with, because we want you to be successful. Now, this is just an example, but there are some topics in the curriculum that are not desirable, that may not be desirable to certain schools. For example, Catholic schools have typically been quite hesitant to partner. So let's say, for example, your school says, yeah, this sounds great, but you're not allowed to talk about pregnancy options. What are you going to do? Are you still going to be able to be part of this program? We're asking not to lie to the school and say, it's not really that big a deal, we can leave it out. We need to make sure that the students are getting the full curriculum. So if there are any topics for which the school is not able to have you facilitate, that may not be the right school, and you may want to find a community partner who will let you discuss this more thoroughly. And as I've said before, removing core components of the curriculum like this are not an option, unfortunately. That said, we would love to have as many of you on board as possible, and I'm available here, Becky's available here for any questions you have right now. And as we move forward, just an email away. So, are there any questions from any of you fine folks? I'll give you a minute to type in the chat if that's how you prefer that. Okay, well, there's a couple of email addresses and links I'm about to post in the chat. And these are where you can email if you have any questions. So the first is myself, which is snoble@cpha.ca. Or the first is that. The second is youthrse@cpha.ca. I monitor this inbox as well. You're probably going to be stuck with me whenever you email. And finally, I'm going to put in a link, which is not showing up at this very second, to where you can get all the information about this program along with the appendix that you'll need to submit from your local school or community groups. Now, if you can't jot them down right now, that's no problem at all. I will send out a copy of this information to each and every one of you who were registered today. Hopefully the people who weren't available will also be able to benefit from it. And we will be sharing this video on our YouTube channel. It should be available by tomorrow. So with that, we'll say, go enjoy the rest of your day. Hopefully we're not taking up too much of it. And please contact us if there are any questions, or feel free to forward this information to anyone else who might be interested in facilitating this program, or, you know, who may have contacts with folks who could really use this program.
Thank you, everybody. It was lovely to spend some time with you. Have a great day.
Okay.